So Andrew, if there's a caregiver out there and they're having difficulty with their loved one with regard to their sleep pattern, which I think is a somewhat normal thing.
Common, yep.
How might they, what can they do, or how might they go about dealing with that?
Yeah. So there are many things that you can do to help your loved one get a good night's sleep. And the first thing is to write down their current sleeping. And I don't mean in general, I mean specifically. So I want you to track it for a week, or even better, 2 weeks, and see what the pattern is. And, sometimes a pattern might be something like this. They go to bed at, 10 o'clock. They get up at 8 in the morning, and they tend to be awake and sometimes perhaps wandering around the house between, let's say, 1 in the morning and 4 in the morning. And then they take a nap in the afternoon for an hour. So the reason, if it's a scenario like that, the reason I would argue that they're up for 3 hours in the middle of the night is simply that they're trying to sleep too many hours a day. Going to bed at 10 p.m. and getting up at 8 a.m. and especially with a nap for an hour in the afternoon, it may sound like a fine amount of sleep, but it's not. It's actually trying to sleep 11 hours during the day. Okay? And most people, whether they're, young and working, or whether they're older and have dementia, only sleep about 8 hours a day. And so the person who goes to bed at 10 and, gets up at 8 a.m. and has a nap for an hour in the afternoon is going to have 3 hours at night when their body says they don't need to be asleep. And that, in my experience, is the number one issue. And many times, people with dementia, they may be a little bit tired by the time the evening rolls around. Maybe they want to go to bed at 8 o'clock, and maybe they sleep 8 hours. And then what happens? Then they're up at 4 in the morning,
Right.
And then the families often don't understand this. And so they're looking for a sleeping pill from me that's going to make them sleep, from 4 a.m. to 8 a.m. But that's not the problem. The problem is that they just, cannot, nobody can or should, sleep for 12 hours a day. So the first thing I always recommend, write down a sleep log, find out when your loved one is awake and when they're sleeping, and you need to work to consolidate their sleep so they're sleeping about 8 hours. It should be about the same amount of sleep as when they were younger. Some people, 7 hours is the right amount. I'm actually like that, and so for me, you want to find the right 7-hour window, and obviously you want to try and align your loved one's sleep with your sleep as much as possible, so that it can correlate. Now, tips you can use to, moving people's sleep cycle. If they're sleeping too late in the day, set an alarm, have them get up earlier and earlier. If they're taking naps, a short nap is fine. A sort of like a 20-minute nap, 10 to 20 minutes would be sort of the right amount of time for a nap. Then work on getting them up. Because if they sleep too long for a nap, I used 1 hour in my example, but 1 hour is really too long for naps. It would be better to be a 10 to 20 minute nap. That's the right amount of nap that won't interfere with sleep later on. If they're falling asleep too soon, like let's say they're falling asleep at 8 p.m., make sure they do get a short nap in the afternoon. That will help to relieve that sleep pressure and allow them to go to bed at a more normal time, maybe 11 p.m. Maybe that's the right time for them. to go to bed. You can help to shift their circadian rhythm, their sleep time, by making sure they are out in the sunlight during the day, or in a nice sunny room during the day, especially between 1 to 3 p.m. And if you want to try a medication, the medication to start with would be some melatonin 1 hour prior to sleep. And I would say, speak with your doctor about sort of the right doses and the right approach. But just remember that melatonin isn't a medication that makes you sleepy. Melatonin is a medication that helps to adjust your sleep cycle. So it's good if people's sleep cycle is off.
Hey folks, connecting with your benefits is our primary mission, and the SITREP is providing more options than ever.
Subscribe to our free email newsletter, subscribe to our audio podcast channel, or subscribe to our content on YouTube.
For details and links, check out the description below.